Do you feel like your tinnitus ringing in the ears can get worse based on hearing other kinds of sounds? Maybe a loud sound makes your tinnitus worse. Maybe even a soft sound or a moderate sound makes your tinnitus worse. Maybe voices, environmental sounds, music seems to bring your tinnitus up in volume. This may be reactive tinnitus, and in today's video, I will explain all you need to know about reactive tinnitus. My name is Dr. Ben Thompson. I'm an audiologist and tinnitus specialist. I completed an audiology residency at a major hospital in San Francisco, California, UCSF, and a few years later started an online telehealth business for people who suffer from tinnitus. At TrebleHealth.com, we have a team of specialists that work with all kinds of tinnitus, including reactive tinnitus and hyperacusis, and we provide treatments and options to manage your condition. So if you are interested in any of those medical devices or treatments, please head over to TrebleHealth.com to learn more about what we provide. If you're new here to our YouTube channel, please like this video if this topic is of interest to you, and subscribe so that you can stay in touch and in tune with what we're providing here, high quality educational information for those who are living with tinnitus. Reactive tinnitus refers to tinnitus that changes in loudness, pitch, or quality in response to average or even low level sounds. The resulting tinnitus can be more distressing and cause discomfort or pain. Sometimes this is also referred to as tinnitus-induced hyperacusis or sound-sensitive tinnitus. Reactive tinnitus occurs from changes in the brain that affect the way that auditory neurons inhibit or increase activity for different sound stimuli that enters the system. Fortunately, these changes are not permanent. There's nothing permanently broken in your system. The brain is very adaptive and therefore can respond very well to therapies or treatments. True reactive tinnitus is quite rare, as most kinds of tinnitus don't worsen with the presence of external sounds. It's very important to not self-diagnose yourself with reactive tinnitus, because if it only happens occasionally or mildly, then you don't want to put yourself in the bucket of, I have reactive tinnitus, sound therapy won't work for me, nothing's going to work for me. First of all, that's not even necessarily true, but it's also just important to be mindful of self-diagnosing yourself with a certain condition. It's estimated that anywhere between 12 and 63% of people who have tinnitus also experience hyperacusis, or what's called decreased sound tolerance for average level sounds. However, tinnitus does not necessarily worsen for those people who experience some sensitivity to other sounds. So hyperacusis means sensitivity to everyday sounds. Reactive tinnitus means my tinnitus gets significantly louder consistently when I hear everyday sounds. If you have reactive tinnitus, then the worsening of your tinnitus can lead to negative emotions and reactions, of course, and that can create this negative loop where you try to avoid certain sounds, and then your lifestyle is quite different because you're not around sounds. You might even try earplugs, but aren't sure about how exactly to use earplugs. And all of these factors make it difficult for someone to manage reactive tinnitus on their own. I believe that a professional like those at Treble Health on our team can step in and really guide you through this process, because if you do have truly reactive tinnitus, then it's not easy to manage it on your own, and there are real resources to help you. Unfortunately, avoidance of sounds like the use of earplugs can accidentally make this condition worse, because your tolerance for everyday sounds becomes more sensitive and less tolerant. So it can create this negative loop of trying to avoid sounds to not trigger your reactive tinnitus, but then your reactive tinnitus becomes more sensitive. And again, like I said, best to have professional advice and guidance through this process. This is a short break from today's video to announce the Tinnitus Guide by Treble Health. Do you want to learn about the newest tinnitus treatments and management tips? Click the link in the description of this video to get your free copy of the Tinnitus Guide by Treble Health. How is reactive tinnitus treated? Well, reactive tinnitus is treated quite similarly to regular treatments for tinnitus and hyperacusis. We want to create a personalized sound therapy plan, and that's so important when you have reactive tinnitus, because it's typically not all kinds of sounds that trigger the reactive component. So we need to isolate and test what kind of sounds can your system tolerate, and let's use those to our advantage for a sound therapy treatment. When we pair that with one-on-one coaching or counseling for tinnitus, things tend to work quite well. Tinnitus retraining therapy, for example, should be considered if you're experiencing certain kinds of reactive tinnitus, with the help of a professional who is trained in TRT, tinnitus retraining therapy, that can work quite well for your conditions. Sound therapy is often part of the treatment plan, but it may come later on, not immediately, because immediately we may be working on some of the more fundamental concepts to get you over the hump with this really challenging reactive component. Having one-on-one coaching or counseling is a very important part of the treatment. It's a complex condition, and to go through it alone is not easy, but there are tips and tricks that others have learned over time, and as professionals, that's our job to teach them to you. For example, changing negative thoughts or reactions to sounds and to reactive tinnitus can be very effective. Although it is difficult, it is something that I definitely want you to use in your toolkit. That's often what cognitive behavioral therapy will focus on, and there are elements of how CBT from a psychologist, for example, can be very beneficial for someone with reactive tinnitus. Breaking those negative feedback loops can be so key here. So if your brain has been trained to have anxiety or fear around certain sounds, and those sounds make your tinnitus worse, then we need to get out of that loop and find strategies and tools and different sounds that can help us. There is real hope out there for reactive tinnitus. I've seen different kinds of reactive tinnitus have a full recovery. So please do have hope. Work closely with an expert audiologist on this, and I believe that your reactive tinnitus can get better over time. And a final thought here, when sound therapy is used, it's always started at a level that does not trigger your reactive tinnitus. That's our job, to find sound therapies that can do that. And that's where we would start. We would gradually consider increasing the level of sound therapy over time or the duration of use. Gradual exposure to those sounds over time trains the brain that sounds are not a threat, sounds are not dangerous, and we do not have to be hypersensitive and overreacting to them. Again, this is not a mental reaction. This is a physiological brain reaction. So that's what we're trying to retrain over time, and that can absolutely happen. Sound therapy may need to progress slowly. Different people can have different speeds of improvement with it. So be patient. Work with an expert on our team at Treble Health, and I have confidence that we'll be able to help you if you do have reactive tinnitus. Even though reactive tinnitus will respond slowly to treatment, the treatment is there, the treatment exists. I interviewed an individual on our YouTube channel here who dealt with hyperacusis and reactive tinnitus for about 2 years, and it was a severe case, but he improved and he's working his job. He's back to normal. He kept working and he kept his job during the whole process. So there is hope, and there's many people out there who have done it. Please do get help if you need it. You can reach out to us at treblehealth.com. Thank you for watching this video. Remember to like, subscribe, and share this video if other people with reactive tinnitus need to hear it. Post it on Tinnitus Talk, Facebook groups, Reddit, wherever you need to. Thank you so much. I appreciate it. My name is Dr. Ben, and I'll see you on the next video. Bye-bye. Thank you for watching today's video with Treble Health. Check out our next video by clicking the button on this screen or another recommended video. And if you're not already, make sure to subscribe to our YouTube channel. Thanks so much. See you on the next video.